If your doctor has prescribed you levothyroxine or Synthroid and they have no plan to get you off that thing, then I promise you what I'm about to show you, your standard practitioner or endocrinologist has most likely not tested you for. And I can say this, I've seen hundreds of labs that come incomplete from prior visits with endocrinologists where they think they're getting proper thyroid testing done, but it's just a very incomplete picture. Now, I'm talking with this patient tomorrow and I'm looking at some labs here today and I found some things that I think more people should be tested for, especially if you're on a thyroid medication. The two antibodies right there, thyroid peroxidase and thyroid globulin antibodies, should always be tested with a complete thyroid panel. Why? Well, because 90% of hypothyroidism patients are experiencing Hashimoto's or an autoimmune situation. Not only that, vitamin D levels, guys. This patient had levels of 31, which you don't want to be anywhere near 30 or below. In an autoimmune patient like we just found here, she's got antibodies that are elevated. She's going to need major support for her immune system. Not only that, we're addressing why her thyroid is having issues in the first place. The immune system is very important here. And of course, we found that a lot of her main food she was eating, her main protein was eggs too, and she was eating these every day. She's allergic to them, guys. This is creating a inflammatory response. It's causing destruction to her thyroid. That's why we're seeing antibodies in the first place, an autoimmune situation. And it makes you wonder that they're suspecting by 2026, levothyroxine alone will make something like $4.1 billion. So we're hiring more doctors. They're prescribing these like they're candy, and they have no plan for you until we sit down and do a complete look into your thyroid. You need complete testing done. And I've had handfuls of patients that have been able to take themselves off of their thyroid medications as long as they're being supported for their immune system, for their stress they have, especially from an adrenal perspective. You gotta get the complete picture done, especially if you're getting no answers and you're still on that thing and still struggling with symptoms.